What if I told you that a heart attack could strike without warning, and if you're alone, you might only have 10 seconds to save your own life? Heart disease remains one of the leading causes of death among people over 60. For many, the first sign of trouble is also the last. And when it happens at home, in silence, without help nearby, survival often depends not on luck but on preparation. As a specialist in cardiovascular care with over 35 years of hands-on experience, I've seen how fast a heart can fail and how small, simple actions can sometimes turn the tide in your favor. I'm not here to give you generic advice. I'm here to give you what I know works because I've lived it, and because it's helped save others too. In the next few minutes, I'll walk you through 5 life-saving techniques that anyone can do even if you're alone, scared, or barely conscious. These are fast, effective methods grounded in both Western and Eastern medical practice. Some might surprise you. One, in particular, might make the difference between staying alive and never getting the chance to say goodbye. Stay with me until the end, because the last technique might be the one that gives you the strength to make it through. Ready? Let's get into it. Now, let me show you the first technique that could keep you alive when seconds matter most. Technique 1. Chewing aspirin slows clotting, buys you time. Now, let me show you the first technique that could keep you alive when seconds matter most. When a heart attack strikes, one of the most dangerous elements is the sudden formation of a blood clot in the coronary arteries. This clot blocks oxygen from reaching your heart muscle, and within minutes, permanent damage can begin. The sooner you act, the better your chances of surviving. That's why aspirin, something so simple and familiar, can become a powerful tool in those first critical moments. Aspirin isn't just a pain reliever, it's a well-studied antiplatelet agent, which means it helps prevent blood cells from clumping together to form clots. By slowing this process, aspirin may stop a partial blockage from turning into a complete one. But here's the most important part. You must chew it, not just swallow. Why chew? Because chewing the tablet allows it to be absorbed faster through the tissues in your mouth and upper digestive tract. Swallowing it whole could delay absorption by 10 to 15 minutes, precious time you may not have. In an emergency, every second counts. Here's what you should do. At the first sign of a heart attack, tightness or pain in your chest, shortness of breath, pressure radiating into your arm, jaw, or back, call emergency services immediately. Then, if you have no known allergies and have not been advised to avoid aspirin, chew 1 regular aspirin, 325 mg, or 2 baby aspirins, 81 mg each. Don't rush to swallow it with water. Let it break down in your mouth as you chew, allowing it to begin working as quickly as possible. I once had a patient, 58 years old, who remembered this exact advice from a heart health seminar. When he experienced early symptoms, he didn't hesitate. He called for help and chewed the aspirin right away. According to the paramedics, that early step may have helped stabilize him until proper treatment arrived. It wasn't a cure, but it bought him time. It's important to understand that aspirin won't stop a heart attack outright. It won't fix a blocked artery, but it can slow the clotting process, reduce the severity of damage, and buy you those extra minutes you desperately need before help arrives. Just remember, never take aspirin if you've been told to avoid it, especially if you're on other blood thinners or have gastrointestinal issues. When used properly, though, it can be the first small step that gives you a fighting chance. Technique number 2. Lying still and preparing for help. Reduces strain, prevents collapse. When a heart attack begins, your first instinct might be to move, to pace, or even to try to drive yourself to the hospital. But movement is the last thing your heart needs in that moment. The second technique is surprisingly simple, yet deeply important. Lie still and prepare yourself for help. During a cardiac event, your heart is already struggling to keep blood flowing. Every extra movement you make forces it to work harder, possibly pushing it closer to failure. That's why the most effective thing you can do immediately after calling for emergency assistance is to reduce physical exertion as much as possible. Find a safe, flat surface, and lie down. If you can, loosen tight clothing, especially around your chest and neck. This helps relieve any external pressure that might worsen your breathing. Next, focus on your breathing. Panic tends to set in fast during emergencies, and shallow, rapid breaths only make things worse. Instead, take slow, deliberate inhales through your nose and exhale through your mouth. Deep breathing helps calm your nervous system, stabilizes your heart rate, and increases oxygen delivery throughout your body. The more control you keep over your breath, the more you support your heart's ability to function during crisis. And don't forget one critical detail. If you're alone at home, unlock your front door if you still have the strength. This allows emergency personnel to reach you without delay when they arrive. Every second matters, and something that small can save precious time. There's a misconception that doing something means action and effort, but sometimes doing less is doing more. Lying still protects your body from unnecessary strain. It prevents sudden drops in blood pressure or dangerous falls if you lose consciousness. It conserves energy your heart desperately needs to survive. Many survivors say they fought the urge to move because they'd been taught otherwise. One patient told me he was about to stand up and look for his phone in the other room when he remembered this technique. He chose instead to lie back, breathe deeply, and wait for help. That one choice may have prevented a fall or worse. So when the pain hits and your instincts scream, "Do something," remember, the second most powerful action you can take is actually to do nothing at all except stay still, stay calm, and let help find you. Technique number 3, forceful coughing, stimulates the heart by critical seconds. It may sound counterintuitive, even strange, but under certain conditions, coughing done with purpose and force can act like an internal defibrillator. This third technique has saved lives in the earliest moments of a cardiac event. While it's not widely taught outside medical circles, it's a powerful response that can give your heart just enough support to keep beating until professional help arrives. The idea behind forceful coughing is simple. When done correctly, it increases pressure in the chest cavity, which in turn stimulates the vagus nerve and helps maintain circulation. It's similar to what happens during a chest compression in CPR, except you're creating the pressure yourself from within. The coughing motion contracts the chest muscles and squeezes the heart rhythmically, helping it stay active when it's struggling to maintain a proper beat. To do it right, you must first take a deep breath enough to fill at least 80% of your lungs. Then, with your mouth closed, use your diaphragm and abdominal muscles to force out a strong, sharp cough. It shouldn't be a soft or hesitant sound. It should be loud, firm, like a punch from the inside. Repeat the cough once every 2 seconds for up to a minute, or as long as you can while staying conscious. This technique is most effective during the very early symptoms of a heart attack, when you're still fully conscious but feel the telltale signs: chest pain, dizziness, difficulty breathing, numbness in the arm, or a heavy feeling in your jaw. If the pain is severe and breathing becomes nearly impossible, coughing may not be feasible, and you should move on to other techniques immediately. There is clinical evidence to support this method. The American Heart Association and several emergency studies have documented cases where forceful coughing helped sustain heart rhythm during the initial seconds of cardiac arrest. While it's no substitute for CPR or defibrillation, it has shown the potential to buy critical seconds, especially for those who are alone. One of my former patients once described how she remembered this technique from a training video. She felt the pain coming on, took a deep breath, and started coughing hard every 2 seconds while dialing for help with her other hand. When paramedics arrived, she was still conscious. She told me, "It felt like I was fighting for every heartbeat." And that's exactly what this technique is for. Remember, it's not meant for every situation. But if you're alone, alert, and feel those first warning signs, forceful coughing might help you stay conscious long enough to survive. Technique number 4. Striking the chest. Reboots the heart's rhythm in critical moments. When all else fails, when you can no longer breathe deeply, When coughing is no longer possible, and consciousness begins to slip, there is one last, direct action you can try: striking the center of your chest. It might sound extreme, even dangerous, but under the right circumstances, this fourth technique can deliver a life-saving jolt to a heart that's faltering. Known in emergency medicine as the precordial thump, this method is used to deliver a mechanical shock to the heart by forcefully striking the chest. The idea is to momentarily stimulate the heart's electrical system and interrupt a deadly rhythm, much like a defibrillator does, but with your own hand. Of course, it's not as powerful or reliable as medical equipment, but in the absence of help, it may be your only option. Here's how to do it properly. First, form a tight fist with your dominant hand, as if preparing to strike a punching bag. Locate the center of your chest right over the sternum, where an imaginary line between your nipples would cross. Using the bottom edge of your fist, strike downward with controlled force, once per second. The motion should be like a hammer swing, firm, deliberate, not wild or erratic. Limit yourself to 5 or 6 strikes, enough to make an impact, but not so much that you risk injury. This technique is only for critical situations when your vision begins to fade, your breath is nearly gone, and no other technique is possible. It's also vital to strike the correct area. Hitting too high, near the throat, or too low, over the stomach, can cause more harm than good. This is a focused, emergency-only method, and it must be applied with caution. I once heard the story of a 72-year-old man who woke up in the night feeling severe chest pain and weakness. He tried to cough, but didn't have the strength. As he started losing awareness, he remembered a health seminar he'd attended years earlier. With what little energy he had left, he balled up his fist and struck his chest once, then again and again. On the 4th try, he felt a sudden jolt, as if something inside him snapped back into rhythm. That gave him just enough time to call for help. Medical studies, especially those in emergency response settings, have noted that this technique has helped a small percentage of patients recover brief cardiac function when applied within the first few minutes of arrest. It's not a guaranteed solution, but in a true emergency, even the smallest chance can be worth everything. If you ever find yourself on the edge of losing consciousness with no help in sight, this technique could be the jolt your heart needs to keep going just long enough for help to arrive. Technique number 5, pressing the EGU point, calms the heart and restores stability. When your heart is racing, your breath becomes shallow and panic starts to rise. Your body enters a dangerous cycle, one where anxiety and cardiac stress feed off each other. This is where a small but powerful technique from traditional medicine can make a big difference. The 5th method I want to share involves applying pressure to a specific point on your hand, known in Chinese medicine as the EGU point, also referred to as Li4. This point is located in the soft web between your thumb and index finger. Pressing it firmly and rhythmically can help calm your nervous system, regulate heart rhythm, and improve circulation. While originally rooted in Eastern practices like acupressure, the technique has gained attention in modern clinical research for its effectiveness during moments of extreme physiological stress. To find the EGU point, look at the back of one hand. Locate the area where the bones of your thumb and index finger meet. Slide your opposite thumb into that groove, just toward the index finger side. You'll feel a small indentation. This is the spot. Now, press down firmly with your thumb until you feel mild discomfort, not sharp pain. Hold the pressure for 5 seconds, then release for 2 seconds. Repeat the cycle for 1 minute on each hand, alternating if necessary. The action does more than just distract you. Studies have shown that stimulating this point activates parasympathetic nervous responses, which can slow heart rate, reduce blood pressure, and even alleviate chest tightness related to anxiety or irregular rhythms. In hospital settings, patients have reported feeling calmer and more physically stable after just 1 minute of focused acupressure on this point. This technique is especially useful if your symptoms are rising but not yet overwhelming. If you feel chest discomfort, dizziness, or a sense of the body shutting down, Pressing the EGU point may help maintain your composure and stabilize your vitals long enough for medical help to arrive. I've had patients practice this regularly, not just in emergencies, but as part of their stress management routine. One woman in her 60s told me she used it during a panic-inducing episode where she felt chest pressure and lightheadedness. By pressing the point and breathing deeply, she was able to remain conscious and clear-headed until the ambulance arrived. Her heart rate, she said, slowed down within 30 seconds. As with the other techniques, this is not a replacement for medical treatment. It's not a cure. But in that narrow window where your body is fighting to hold on, this simple act of pressure may help tip the balance in your favor. Now that you know these 5 crucial techniques, it's essential to understand some important precautions to use them safely and effectively. Now that you know these 5 crucial techniques, it's essential to understand some important precautions to use them safely and effectively. First and foremost, always call emergency services immediately at the first sign of a heart attack. These methods are designed to buy you time. They do not replace professional medical care. If the chest pain becomes unbearable or you feel faint, lie down immediately to avoid injury from falling. When applying any of these techniques, do so within your physical limits to avoid causing further harm. Even if symptoms improve, do not skip going to the hospital. Heart damage can progress silently. Practice these techniques beforehand. Familiarize yourself with the EGU point, practice deep coughing, and know exactly where to strike your chest. When panic strikes, muscle memory can save lives. Remember, prevention through healthy living and awareness remains your best defense. We have explored 5 powerful techniques that can make all the difference if you ever face a heart attack alone. From quickly chewing aspirin to applying pressure on the EGU acupressure point on your hand, these methods are simple, fast, and supported by both modern science and traditional medicine. While these techniques cannot cure a heart attack, they are designed to buy you precious time that can mean the difference between life and death. It is crucial to remember that the single most important step is to call emergency services immediately when you experience any symptoms of a heart attack. These techniques are not a substitute for professional medical care, but rather tools to help you stabilize your condition and keep you conscious until help arrives. Never delay calling for help. Preparation is your best defense. Practice these techniques regularly and share this knowledge with your family and friends. The more people who understand how to respond in these critical moments, the more lives can be saved. You may never need to use these methods, but if the time comes, having this knowledge at your fingertips could make all the difference. Fear of a heart attack is natural, but it should never immobilize you. Instead, choose to live with confidence and preparedness. Knowledge, combined with action, empowers you to take control when every second counts. I am living proof of how these simple yet effective steps can save lives, and my hope is that you never face this challenge. But if you do, may these techniques give you the strength to fight for every heartbeat. Thank you for staying with me until the end. Please take this information seriously, share it widely, and most importantly, take good care of your heart every day. Your life and the lives of those you love depend on it.